One of the great things about being chair of Guy's and St Thomas's is the fact that we're working in partnership with some hospitals in Zambia, and through our association with King's Health Partners with a number of other countries in Africa as well. And I should perhaps mention that one of the other reasons I'm here today, and very much in a learning mode, is that I am chairman of the steering committee that the Department for International Development has established to oversee the health partnership scheme that THET are running on behalf of DFID, and that provides a range of grants for partnership working. So what this is now about is a debate, and the motion before the House is that this House believes global health partnerships offer an appropriate and sustainable approach to international development. I have to say that the last time I participated in a debate which began this House was getting on for 50 years ago, I think, at school, where I proposed the motion that this House would abolish the monarchy. We lost by 98 votes to 1. My seconder voted with the opposition, so that sets a lot for my advocacy of that particular cause. So I think we'll reserve judgment on whether we have a vote on this particular motion to the end of the day. But the key thing is here we've got 4 really good and distinguished speakers to help us look at the arguments about what can and can't be achieved through partnership. So arguing in support of the motion are Dr. Shams Syed, who's a former GP and a leading international expert on public health and preventive medicine. He's currently the Programme Manager for African Partnerships for Patient Safety, based in the WHO headquarters in Geneva, a programme now working in 14 African countries and 3 European countries. So a real expert in his field, and he's going to be supported in arguing in favour of the motion by Dr. Liz Grant, who's the Deputy Director of the University of Edinburgh's Global Health Academy. Her research work focuses on palliative care within low-income countries, and Liz leads a THET multi-country partnership programme, which is about strengthening and integrating palliative care into national health systems. And you can read the more details in her biography. Speaking against the motion, bravely, are Professor Tim Eden, who's from the World Child Cancer. He's a distinguished oncologist with a national and international reputation. He's published over 300 peer-reviewed papers, editorials and book chapters on paediatric and adolescent hematology and oncology. He's a founding trustee of World Child Cancer and a paediatric advisor to AFROX from 2007. So a very, very distinguished expert in his field. And he's going to be supported by Chris Smith, who's the in-practice fellow here at Imperial College, working on, just completed an MSc in public health in developing countries. And his research interests include a wide range of things, and is working overseas in a number of countries on health partnerships. So a dazzling array of speakers. The rules of the game are this. They're going to have 10 minutes each, and I'm going to alternate between the speakers for and against the motion, and we'll have to be strict about time again, so that's obviously a theme of the day. Then when they've had their say, I'm going to throw the motion open to the House, and you'll have an opportunity to make comments, make contributions, ask questions if appropriate. Then I'm going to give the speakers 1 minute each at the end for a final thought. So without further ado, let me hand over to Dr. Syed, who's going to speak in favour of the motion that we've got before us.
Good morning, everyone. So when Andrew and THET colleagues asked me to speak in support of the motion, the first thing that I mentioned was I'd very much be happy to speak against the motion. Don't know why I said that, but this might be something to do with the general tendency of people involved in partnerships to be able to debate and to see different sides of the same story. So before launching into the actual thrust of my argument, I'd just like to ask, how many of you have seen The Magnificent Seven? Okay, so that's impressive. I see there is probably an age, but anyway, so that's it. The Magnificent Seven is the second most widely televised film on US television ever. And I'm going to use their help in... Oh, did you take that one? In getting the point across that the House believes global health partnerships offer an appropriate and sustainable approach to international development. And each one of these magnificent folks has something to say about global partnerships. So Yul Brynner says that partnerships are active. Partnerships work on verbs, doing and at the same time learning. At any one point, partnerships are involved in all layers, can be involved in all layers of activity, right from the front line, which is, I think, a critical element of their potential success. Partnerships are needs-driven. So we heard even already this morning that the needs have to drive action if the action is to succeed in implementing change. And partnerships have an ability to focus on the needs at the front line. Now, coming from WHO, much of the country-led needs assessments are done in capital cities, perhaps even in regional situations, or even at the global level. These are important, but the needs that are identified at the front line can be a really effective mechanism to achieve change at the institutional level, but also at the national level. Positive contamination. What does that mean? So, the technical experts that we've already heard about this morning through some of the examples that we're hearing from Somaliland and Zambia come from a wide range of areas. But there is something special about the technical exchange that occurs within a hospital partnership. So the nurses, the specific specialists, the engineers that are involved in this technical exchange can have an effect of positive contamination. And this does actually touch on the area of mutual benefits. A human being that's working in Hull and a human being that's working in Africa, in Namibia, in Windhoek, is still going to have the same general desire of changing for improvement. This positive contamination can have a huge impact on global health systems. Context specificity. This is critical. At any point in time, if you are not able to rate adjust change, you've created a wonderful, beautiful hospital partnership plan, which many of you have been involved in, but along the line, around 9 months, something's gone wrong, the leader's left, the chief nurse has just been sacked, all sorts of things that happen in reality. If we are not able to rate adjust and use the context to define that rate adjustment, often the change is not successful. Decentralized. Now, as a WHO employee, you might wonder why I'm talking about decentralization. WHO has a sort of like an image of something happening at the global level, and somehow we sort of feel that somewhere along the way, change will be implemented at the front line. Well, there is the need for global norms and standards, but there is also need for action at the front line, which is heavily decentralized. And it does allow learning to flow from the ground to global systems. And this is why this conference is such a wonderful opportunity. Already we've heard that the whole 2 days is geared around learning and shared learning. Decentralization allows that learning to flow from the front line. Networks and the utilization of networks to drive change. I would suggest that this is really inevitable. Networks are driving change right now, and if global health is going not to take notice of that, then we are going to be in a little bit of a bind coming in the next decade, 2 decades, because networks are here. It's not a future-focused approach. it's now, and we need to be able to define partnerships as part of this global network creation. And this is the final point from the 7. Human interaction is, I believe, a channel for passion. No fundamental change, I believe, in humans' health systems or any systems in human history have actually, I believe, been achieved without some form of passion, whether that's at the individual level, whether that's at the institutional level. Some form of passion has driven fundamental change. And I believe that partnerships has an ability to create a channel for that passion to drive change. So those are the 7 points that I would like to put forward from the 7. But if we just take a moment to pause, the Magnificent 7 that you've already seen actually is a remake of a movie that was made in Japan. And does anybody know the name of that movie? Exactly. Seven Samurai, 6 years before the Magnificent 7. So here we are at Imperial College grounds, and we are here thinking about global partnerships from perhaps a Eurocentric focus, but we do recognize that there is that bi-directional learning. And this is my fundamental last point, is that partnerships allow an opportunity to learn from innovations that are occurring today in health systems around the world. Many of the health systems that we are looking at in Africa and Asia and South America are very fluid. They afford an opportunity to tackle changes in a very different way. And the lessons that emerge from that can flow back to health systems in Europe and North America and other parts of the world which are high-income settings. And the other thing to remember is we know that movie as the Seven Samurai, but actually Tsuchini no Samurai does not really have a direct English translation. So I think when we work in partnerships, at every moment we need to realize that there could be something just out there that changes our thinking. And that my final point on this is that partnerships are heavily rate adjustable. They are a way of creating sustainable change at the institutional level, while at the same time stimulating change at national levels, at regional levels, and global levels. Thank you for listening.
Over now to Chris Smith.
I'm going to be arguing against health partnerships. Thanks for Thet to invite me along today. I think it's great that they're doing this, and it's really good to have the discussion. During my kind of devil's advocate role against the motion, I'll draw on some of my experience of involvement in a health link in Cambodia, and then several other pieces of work I've been involved with. So the first question in my mind is, what